According to the National Alliance on Mental Illness, 1 in 5 Americans suffers from mental health, and people with mental illness are facing additional challenges during COVID-19. I spoke to psychotherapist Abby Koch, who has seen an increase in her clients due to the COVID-19 pandemic. We talked about the new normal we're all facing, the importance of structure, space, and boundaries, and advice on how to be proactively engaged with those around us.
So things were very slow, but everybody was transitioning their clients very nicely to virtual. But I would say in the last few weeks, we've been getting more calls because I think people are realizing, okay, this is our new normal for right now. So the increase in referrals for parents are actually higher right now because parents are calling us because they don't know what to do with their kids.
For parents, there are resources such as the National Crisis Text Line, where you can receive free crisis counseling.
I think the first thing we talk about with our clients is stressing the importance of pretending that you're going on with your normal day. Make sure that there is structure throughout the house until the end of the school day. It's really easy for teens to get, wanting to sleep late and stay in their pajamas all day. Struggling with getting up and, they're in sports, but they can't be on their teams, or it's still important to start your day with something. The teenage age group is a difficult one. All of a sudden, one day, they weren't allowed to leave and go be with their friends, which is very important to them. So we're working with them on trying to stay positive and, some tools to set some boundaries so when they are at home, they still have their space that they need. And I'm also encouraging them, be on the phone with your friends. Like, we're noticing that there's less of arguing, less of depression, less of anxiety because they have a structure to work with. We all thrive with structure.
Right. The National Alliance on Mental Illness, or NAMI, also has a COVID-19 resource guide online that answers frequently asked questions from how to handle anxiety and social distancing to how to access healthcare and medications. It's also available in Spanish at nami.org/COVID-19.
We're seeing a lot of interesting things, like a lot of families are bonding more and picking up hobbies that they never really had time to do. We work with a lot of people to take advantage of this time as much as they can. So, if they're home and they're not working, this is an opportunity to explore options for when things go back to normal, if maybe they want to do something different.
We're all in this together, and maybe staying in today can open doors for tomorrow. For LUTN, I'm Angel Olivo.